Hi there, my name is Farhad Pirani, and I'm an assistant professor of medicine at the University of Alberta Hospital in the Division of Gastroenterology. I have a special interest in inflammatory bowel disease, and in today's session, I will be discussing the topic of inflammatory bowel disease in the elderly. Well, the first question we need to ask is, how do you define elderly? Is it over age 55, over age 60, 65? Well, truly, I think there's no great answer to that question. However, the majority of studies that have looked at this question have used the cutoffs of 60 or even 65. Chronological age, though, is not always the best way to gauge how patients with IBD will do. And I will talk about the concept of frailty further on in this presentation. Now, how common do we diagnose IBD in the older patient population? Literature in the past has shown us that there tends to be a bimodal distribution of when IBD is diagnosed. The first peak occurs typically around age 20, and the second peak will occur typically around age 60. And 10 to 15% of IBD patients will present after age 60. The global population is becoming older, and we know this. And that holds true as well for IBD patient population. So if you look at the IBD patients across the globe now, roughly 10 to 30% of them will be over age 60. There was also a recent Canadian study done looking at this question of IBD in our senior population. And what they reported was that 1 in 160 individuals, not IBD patients, but 1 in 160 individuals in the general population over age 65 has IBD in Canada. That's approaching 1% of the population. That is a significant portion of the population that we will have to manage in the future, or even you as patients may have to deal with as a chronic illness. There's also a distinction that I think is very important to make, and that's the distinction between older patients with IBD who were diagnosed in their younger years and now are aging with their IBD, as well as those patients who are truly diagnosed and become symptomatic in their older years, say at age 60. And the two groups likely have different sort of reasons for their disease, and perhaps even different management options could be catered to the two separate groups. Unfortunately, the majority of the literature or the manuscripts that have been published to date don't always distinguish between these two groups. To be completely honest, we don't have a good sense of what causes IBD in the elderly. However, today I want to focus on three concepts that perhaps provide some speculation as to what may be causing this disease process in older patients. The first aspect is dealing with vasculature or blood flow to the colon. Now, as we age and patients get older, the blood vessels in the body become slightly compromised. There's an older study with small patient numbers that looked at blood flow distribution in the colon and how that may perhaps predict the extent of inflammation in the bowel. Second is that there is a higher proportion of ex-smokers in elderly onset ulcerative colitis patients compared to adult onset ulcerative colitis patients. And lastly, statins, which lower cholesterol in the body and affect the blood vessels, they have a protective effect on new onset ulcerative colitis. The second concept I want to focus on is the microbiome, and I'm sure you've heard of how the microbiome is implicated in inflammatory bowel disease, and I would expect no less for it to be implicated in the older patient population. And as patients age, we may see a variation in microbiome composition. So certain bacteria, such as Bacteroides, Firmicutes, Lactobacilli, etc., may increase in abundance, whereas other protective bacteria, such as Bifidobacteria, may decrease. We know that microbiome can be affected by many things. Smoking, diet are some of the factors that can play a role. And the last concept I wanted to briefly touch on is the concept of immunosenescence. As individuals age, the immune system remodels. And this remodeling of the immune system, termed immunosenescence, has been implicated in disease processes such as cancer, as well as in inflammation. And so this process where various, parts of the body are affected, such as the bone marrow, the thymus gland, various blood cells, such as T cells and B cells, become affected. And their typical or usual response to stimuli in the body can be aberrant or abnormal and subsequently trigger an inflammatory cascade. Lastly, in terms of what causes IBD in the elderly, it is thought that younger onset patients have more of a contribution from genetics, whereas the older patients who have an onset of IBD in their 60s or 70s will have a greater contribution from environmental stress or triggers.